Good morning. It's 1027 and 1035 WICY. Feel good favorites from the 80s and more. My name is John Kazar, joined by Dr. Todd Whitman. And Todd, you're with Hyde Medical Center. You've been alternating every other week now with Matt Jones, who's, the chief executive operator? I don't know what the exact title is for him.
He's our chief operating officer.
There it is. And you are?
I'm the assistant chief medical officer for CVPH in Hyde.
I'm sure you've been a busy guy, just maybe not immediately lately, but just over the last 4 months especially, huh?
Yeah, indeed. It's been a pretty remarkable experience. But, boy, we've done a great job in our community, and I'm happy with where we're at right now.
Gotta be. And let's talk about some nursing home visitation guidelines that have changed recently.
Yeah, so as you're aware, since mid-March, visitation in nursing homes has been suspended, which has been really difficult for residents and their families during that time. And on Friday of last week, the state health officials released some guidelines and pretty strict criteria for some limited visitation in the nursing homes. Some of that can start as early as next week. Within those strict guidelines, they really nail down to specifics like how many visitors you can have at a time, specific information that needs to be obtained from each visitor so we can assess their risk to the residents, where you can host visitation, staffing requirements. And important for us, there's a 28-day period that you have to have no positive COVID cases in your nursing home before you can start visitation. And on July 8th at the Alice Center in Malone, we did have a positive COVID case. So we won't be eligible for visitation to begin until the 5th of August.
Okay.
But as soon as we're eligible, we'll certainly, within their guidelines, start to open things up. Yeah. Interestingly, though, our assisted living program does allow us to have some visitation starting as early as next week, and the details of that are worked out. So we're excited.
Yeah, no, there's a lot to be excited about. Talk about how you guys are now a New York State testing site at Hyde Medical Center.
So, yeah, we've applied to be a New York State testing site. We anticipate that will happen sometime within the next 1 to 2 weeks. Basically, that allows us for certain, probably 1 day a week. We're trying to work out those details to offer free asymptomatic testing for members of our community who are looking for testing. That, I think, will be really helpful in our reopening efforts and also gives people peace of mind if they're not really sure, just would like to be tested, have returned from traveling or, had other family members that have come to their house from other areas. So I think a really nice thing that we'll be able to offer. And the details are being worked out at this time, and hopefully we'll have more for that next week.
All right. Well, it's been great just chatting with you over these last few months again, Todd, and we appreciate all the work you've done, and I know there's probably still some more to go, huh?
There is indeed. Another piece of good news, we had to close the IMCU at Alice Hyde over the course of the last week due to some exposures. And happily, we're able to reopen and get that service up and running again as of today. So great news there as well.
Sure thing. Hey, Todd, thank you so much for your time, okay?
All right. You have a great day, John.
All right, I will. 1027, 1035 WICY as we are inside the community with those at Hyde Medical Center. Dr. Todd Whitman.